สวัสดีค่ะกราบเรียนท่าน
Greetings to Dr. Sathit Pitutecha, Deputy Minister of Public Health, and all distinguished guests. My name is Thitiporn Tantivejkul, and Kwanchanok is here. We will be your hosts for this meeting. Due to the fact that we have a lot of interested parties, we will use English throughout our Congress, but we will be using a little bit of Thai. And we have provided simultaneous interpretation for both Thai and English. For those who are here in person, you can choose to listen to your preferred language from the headset that you got from the registration table. And for those who are following from our platform, you can choose Thai language from the right button from the virtual stage. Please, Kun Kwanchanok. Thank you, Kun Thitiporn. สวัสดีครับจากกรุงเทพประเทศไทย
Welcome to the 4th Asia Pacific Patients Congress. My name is Kwanchanok Tantivejkul, and together with Kun Thitiporn here, we are going to be your hosts for this event. But before we start, I'd like to highlight that the Congress provides simultaneous interpretation into both Thai and English. In fact, our interpreters are in the booth there. The translation headsets are available next to the registration desk. And for those joining us online, you can choose your preferred language by clicking on the button on the right-hand side of the virtual stage. The 4th Asia Pacific Patients Congress, or APPC 2022 for short, is organized by IAPO, the International Alliance of Patients Organizations, in collaboration with their Thai member association, the Heart to Heart Foundation. Through APPC 2022's theme of patient co-creation in developing innovative and resilient health systems in Asia Pacific. We'll be exploring how to promote innovation, good governance, and equity in Asia-Pacific health system with patients' engagement throughout the development process. We will also look at how interested parties and stakeholders can all collaborate in building back better. After holding the last 2 APPC editions virtually, we are thrilled to be holding this year's Congress in person in Bangkok, Thailand. And I'd like to thank the Philippines delegate for hosting last year's edition. Thank you.
Now, to mark the opening of the Congress, the City of Ellos has sent 2 of their own with all the blessing for a successful outcome. We present you Thai classical dance กฤษดาพินิหารขอเชิญรับชมค่ะ ขอบคุณนักแสดงทั้งสองค่ะ
That was a wonderful presentation there. And now, to ensure that we reach out to as many patients as possible in the region and globally, we are also broadcasting the entire event online via the Congress platform. For those who are following us online, we have made the event experience as interactive as possible. At the platform today, in the platform lobby today, you'll find the photo booth where you can take photos to mark the event and share on your social media using the event hashtag #APPC 2022. You can check the social media booth, a dashboard highlighting the conversations happening on Facebook, Twitter, and Instagram under the event hashtag #APPC 2022. And there you will also find the Congress agenda for download and get support from the information desk.
Here at APPC 2022 today, we are delighted to welcome more than 850 registered delegates from 86 patient organizations and 53 countries around the world, with 448 delegates attending in person. We have 48 speakers and moderators presenting as well.
Wow, that's really impressive, and it really speaks to our heart on our journey of advocating for patient-centered healthcare. And lastly, we invite you to join the conversation on all social media platforms using the event hashtag, again, hashtag APPC 2022.
Now, to get our Congress going, we'd like to invite on stage IAPO's board member of the SEARO region, อาจารย์อรจิต บำรุงสกุลสวัสดิ์ ขอเรียนเชิญอาจารย์ค่ะ
สวัสดีค่ะ Good morning, Your Excellency, Deputy Minister, Ministry of Public Health, Dr. Sathit Pitutecha, Chair of Heart to Heart Foundation, Dr. Vichai Chokvivatt, distinguished delegates, both online and in person in this room here. Welcome to Bangkok, Thailand. I hope you enjoy some time already shopping in Bangkok. And it's a great opportunity to organize the 4th Asia Pacific Patient Congress 2022. Patient co-creation in developing innovative and resilient health system in Asia Pacific on 23rd to 24th 2022 in Bangkok, Thailand. That means we will have one more tomorrow. The Congress has been organized every year since 2019 by International Alliance of Patients Organization, or IAPO, and co-hosted by our members in Asia Pacific region. It has been virtually in the last 2 years because of COVID-19 pandemic. And this year is co-hosted by our member in Thailand, Heart to Heart Foundation, which also my organization. I'm so exciting to organize this year in face-to-face also. And I understand that our member also online today, they also excited together with me. And I would say that as Your Excellency had reported and had endorsed the PALO Declaration by the Health Minister of Member States at the 75th session of the WHO Regional Committee for Southeast Asia on Universal Access to People-Centered Mental Health Care and Services in Bhutan. And that day, I also joined the committee, and I have heard our Deputy Minister, Dr. Sathit, also. He has, provide his good speech also. And one to accomplish is to develop country-specific targets to achieve universal primary care-oriented mental health services, which we have seen that Thailand have already achieved, especially during and post-COVID-19 pandemic. So, in this Congress, I believe you people will gain much knowledge and experience from the expert speakers, which already in this room. Our speakers are from the region, including Thailand. Don't forget to visit some places in Bangkok and also in Thailand as well. Now, please let me invite the Deputy Minister, Ministry of Public Health, Dr. Sathit Pitutecha, to provide your keynote speech. Your Excellency, please เรียนเชิญท่านบนเวทีเลยค่ะ เชิญท่านที่โพเดียมเลย
สวัสดีครับท่านประธานผมขออนุญาตพูดเป็นภาษาไทยนะครับท่านประธานกรรมการและ CEO International Alliance
of Patients Organization or IAPO, Mr. Ellos Brosny, Mr. Paul Mendoza, IAPO board members, Mrs. Orajitt, Bumrungskulswat, IAPO board member and secretary, Mr. Kawaldip, CEO of IAPO, Ajahn Vichai Chokvivatt, chairperson of Heart to Heart Foundation, and Dr. Ceremonies, Secretary General Heart to Heart Foundation. Distinguished guests and all the participants who are here in person and online. First off, I'd have to tell you that me and Ajahn Orajitt and Kawaldip have met in Bhutan. Ajahn Orajitt has told me about the IAPO's mission on how to engage patients and how can they take care of themselves, and which is actually matching with my thoughts. The Ministry of Health has to adjust themselves accordingly as well. We take care of patients and we have service units across the country. We will need to we need to go for patient-oriented approaches as well, which is similar to what IAPO is now doing in this region. Ajahn Orajitt told me that there would be a meeting organized for the 5th time in Asia Pacific, 4th time in Thailand. So I'm very pleased to come here and show my support for everyone. This meeting is held to strengthen patients to develop innovative health systems and to bring together APAC regional members with diverse health care stakeholders to discuss way forwards to promote innovation, good governance, and equality in the health system in the Asia Pacific region. Through patient participation, real understanding, and co-creation for better results. Now the Asia Pacific region is poised to return to normal state after the COVID-19 pandemic. Patients in the region are prepared to support and participate in both national and regional projects to ensure that health systems in the Asia Pacific region are predictive, preventive, participatory, personalized, and provide accessible, safe, quality, and acceptable health care. Thus, this consultative meeting is required for clear understanding and cooperation to drive practical results in each country in this region. Thailand, we just hosted a global meeting, which is an APEC meeting, on the 18th to 19th of November. I got to meet leaders in this region, be it the health ministers. We had exchanged about the COVID situations. We discussed and exchanged our perspectives. I told them about Thailand, about how we have the very good health systems and can accommodate all people, everyone, under the universal health coverage. And Ajahn Vichai, Ajahn Sangwan are vital and play key roles in making this universal health coverage happen. And we are all always accepted by our universal health coverage, where Thai people can access health care and they can access medicine, affordable medicine, and we have capable personnel. We are very proud of this system we have, and of course there may be some cons to our systems, but compared to the fact that Thai people get to access healthcare, this is something that we are proud of on behalf of Thailand and also on behalf of people who pioneered this system. So this is what Thailand is take pride in, as well as social security system and healthcare for government officials, which cover health promotion, disease prevention, treatment, and rehabilitation, emphasizing on primary care, which is close to home, and patients can be referred for secondary and tertiary care seamlessly. So I'm trying to bridge the emergency care. In case of emergency, patients can get emergency care as soon as they need to for their health and safety. So this is what the health ministries takes pride of. We also developed service system to meet the needs of patients by focusing on the patient-centered service system. As I said earlier, I have consulted with Secretary Jadet. I have provided different service unit with the policies needed to be implemented. I told them that after COVID-19, we have service units across the country. We do not have to think whether the unit would be at loss or whatever, but we have to focus on the patients to provide them with the best health care, because post-COVID, each service unit have been given quite tremendous fund for the care that to be provided to the patients. This is so when in the diagnosis process, we also focus on the quality and safety of, and also patient as center approach. And I already went for the Sky Doctor system in Got Mark Island in Trat province to enhance the confidence of tourists who are coming here, and also our domestic tourists as well. Mark Island is far from hospitals with full equipment. The travelers need to travel by boat and by car. I work with the Navy to deploy the helicopter that is not being used, so that they can use these helicopters to transport patients to health facilities as soon as possible. And in order to get a diagnosis whether the patient would need to use the helicopter or not, the doctor has to be the one assessing the condition. From the assessment, we have to also conduct drills, because in order to transport the patients to the helicopter, to the boat and whatnot, it would take 2 hours, and that may incur the loss in terms of the loss of time for getting the treatment. Therefore, we have to practice and have some drills to practice when in case the helicopter is needed. For example, if there is a patient in the highland and the patient is pregnant, and there were cases where patients actually lose their lives because it took a long time for the transport process to happen in Mae Hong Son. So I told that in this Mark Island, I told them that they just need to have a helicopter drill so that all parties know how to collaborate efficiently. So this is what I am focusing on in terms of patient-centered service system and how to best utilize the resources. After the COVID-19 pandemic, in terms of we are now transferring the primary care to the sub-district local administration or the local administration, because then these personnel can be close to the people and can be a support to the people to help promote the health and prevent the diseases. Of course, this transition incurred some problems, but under the legal principles, we do focus on the participation of health personnel and also village health volunteers or health volunteers in Bangkok who play big roles in helping the patients. We have around 1,005,000 volunteers in Thailand, and we have around 1,004,000 volunteers who helped with COVID-19. We didn't have the medical personnel to conduct prompt or immediate disease investigation during COVID-19, but we have these health volunteers who are around 1,004,000 across our country in all provinces. We told them to help us and come work, and it was successful. I have set like an association which help with funeral for them. For volunteers who worked hard and passed away, their family would not be in distress because they would be provided for 450,000 baht by this funeral association for the health volunteers. Of course, these volunteers, if they work hard and if something happened to them, we have set aside some security for them as well, so that they can work as much as they need to help promote the health and prevent diseases. And during COVID-19, we have home isolation, we have telemedicine, and we also send medicine to people's home as well. So this is the innovation by the Ministry of Public Health, which is developed along with the COVID-19 situation. I remember we started from hotel isolation, and then we have field isolation, field hospitals and home isolation. And so this has been the development under COVID-19. We talked about factory quarantine, sealed route, and these are all happening under the context of COVID-19, and therefore we're proud that Thai health systems is being systematically implemented and is modern and is very timely. Currently, the government has removed COVID-19 from a dangerous communicable disease list and designated as a communicable disease under surveillance list instead, because people understand well about this COVID-19. So on this occasion, I would like to thank Ajahn Vichai, and I would like to thank IAPO for organizing this regional event. I'm very confident that we will have an exchange of fruitful knowledge and experience, and this knowledge and experience will be valuable and beneficial to the development of our work, and this will create a way to promote innovation, governance, and equity in the health system in the Asia Pacific region through patient participation. Now it is time. I would like to thank the health volunteers and also the patients who are helping with the organization of this event of IAPO, and I hope that this 2-day event is fruitful to ensure that our patients are being taken care of and that we can promote patients' participations to access healthcare. So now at this time, I would like to officially open the 4th Asia Pacific Patient Congress 2022 now. Thank you.
กราบขอบพระคุณท่านรัฐมนตรีดร.สาธิตนะครับนั้นขอ
Minister of Public Health, please stay on stage for the photo session. ตอนนี้ก็อยากจะขอเชิญดร.วิชัยโชควิวัฒน์ประธานมูลนิธิมิตรภาพบำบัดนะครับเพื่อขึ้นมาถ่ายภาพร่วมกันก่อน
คุณหมอสิริวัฒน์ทิพย์ธราดล Secretary General Heart to Heart Foundation ไม่มานะครับคุณ Kawaldip Sehmi CEO of IAPO คุณ Ellos Lodzeni Vice Chair IAPO Board of Directors คุณ Paul Mendoza IAPO Board Members และอาจารย์อรจิตบำรุงสกุลสวัสดิ์ IAPO Board Member and Secretary. This is for the group photo. last. Oh, maybe, yes. ขอบพระคุณนะครับจะขอเรียนเชิญคุณหมอวิชัยโชควิวัฒน์บนเวทีก่อนนะครับจะเพิ่งลงไป
Stay on stage, and I would like to thank Dr. Sathit, the Deputy Minister of Public Health again. ต้องขอกล่าวว่าอย่าง
As a person who traveled in and out of Thailand during the pandemic, I must say that the Thai Ministry of Public Health did a great job. The control at the airport was excellent. And now we're proud to introduce Dr. Vichai Chokvivatt, Chairperson of Heart to Heart Foundation, มูลนิธิมิตรภาพบำบัดขอเชิญครับ
ท่านรัฐมนตรีช่วยว่าการกระทรวงสาธารณสุขดร.สาธิต ปิตุเตชะท่านประธานและท่านประธานเจ้าที่บริหาร IAPO และท่านผู้มีเกียรติที่เคารพทุกท่านในนามของมูลนิธิมิตรภาพบำบัดผมรู้สึกเป็นเกียรติอย่างสูงที่ได้ร่วมเป็นเจ้าภาพในการจัดประชุม Asia Pacific Patient Congress ครั้งที่ 4 ในหัวข้อเรื่องการร่วมสร้างสรรค์ของผู้ป่วยและการพัฒนาระบบสุขภาพที่มีนวัตกรรมและฟื้นตัวได้ดีในเอเชียแปซิฟิกในครั้งนี้หัวใจ
The key to a good health system is the capability to address public health issues at affordable costs with safety, good quality, accessibility, and high level of public satisfaction, while service providers also take joy in providing humanized health care. Such healthcare system may seem like an impossible dream and ideal, because even the wealthiest country like the US spends 17.9% of GDP on health expenses. Even though tens of millions of US citizens go without health insurance. In addition, the country's poor response to the COVID-19 pandemic left the country with one of the highest numbers of COVID cases and deaths in the world. The United Kingdom succeeded in establishing a universal health coverage system following the ashes of World War II. Today, the UK spends 10% of GDP on healthcare, yet the system suffers from inefficiency due to long waiting time for medical appointments. During the COVID-19 pandemic, the country also experienced very high numbers of infections, serious illnesses, and mortality and morbidity rates, especially in the early phase. Japan successfully established a universal health coverage system only 16 years after the end of World War II. Today, the country shoulders a very high health burden at more than 10% of GDP, forcing it to increase the value-added tax from 5% to 8% and eventually to 10% at present. As for Thailand, after more than 100 years of health system development, we managed to establish universal health coverage system in 2002, with continuous improvements in terms of safety, quality, access, satisfaction of the public and service providers through significant public participation in terms of governance and improvement of service standards. Most importantly, Thailand's health expenses account for only 4% of GDP. According to the third-party annual satisfaction survey, which started in 2003, conducted by one of the country's leading educational institutions, the public satisfaction rate was found to have increased from 80% in the early years to more than 90% at present. While among service providers, the satisfaction rate has also grown from around 40% in the beginning to more than 80% at present. Most importantly, as many as 5 public representatives sit in the National Committee on Health Security System Management with equal voting rights as those from the government, academic, political, professional, private sectors, and local administrative organizations. In addition, public representatives also perform active roles and duties in the Committee for Quality Control and Service Standards. Patients of almost all rare diseases, which usually require high costs and specialized care, continuously benefit from the system, while public participation, especially patient participation in the development of the system, ensures the procurement and availability of orphan drugs. Therefore, Thailand's health system is a good example of patient co-creation. In line with this conference theme, this is a good opportunity for everyone who joined this conference to benefit from our lessons. Thailand also has significant experience in providing people living with HIV with quality and effective care through significant patient participation. Thailand was the first country in Asia to identify an HIV/AIDS patient and experienced the fastest and most widespread epidemic. Today, people living with HIV in Thailand receive comprehensive health care, enjoy a good quality of life, and have active role in the development of Thailand's health system. During the COVID-19 pandemic, Thailand was the first country outside of China to identify a patient. This happened upon the surveillance of arrival at the airport, not after the virus has entered the general population like in many countries. As a result, we were able to effectively contain the pandemic throughout 2020 with around 6,000 cases and only 60 deaths. As a result, during the second, third, and fourth waves, we had an effective response as vaccines started to enter the market. During the wide infection waves in mid-2021, we established quite effective hospital care, home isolation, and community isolation systems. Home isolation patients received deliveries of drugs, pulse oximeters, and 3 meals daily to their doorsteps. With more than 3,000 work-from-home volunteers, our 1330 hotline effectively managed more than 60 to 70,000 calls for consultations and support per day. As a result, Thailand was chosen by the WHO Director General as one of the 4 countries for COVID-19 case studies and lessons learned. During this conference, we will be hearing many interesting topics, including the follow-up to the Astana Declaration on primary health care, as well as technology assessment. Thailand also has experience in both topics, which can be shared. These technologies are advancing and increasing in cost. Therefore, we need the technology assessment system for safety, effectiveness, as well as cost effectiveness to ensure that we can afford the new technologies. While this technology come to be deployed, they must also be equally accessed by all populations. The WHO and other international organizations have requested that Thailand conduct a technology assessment as a model. On behalf of the Heart to Heart Foundation, I would like again to warmly welcome all participants and wish you a successful conference, a pleasant stay in Thailand, and a safe journey home afterwards. Thank you. Thank you very much, Dr. Vichai Chokvivatt. ตอนนี้ก็อยากจะขอเชิญคุณพอล เมนโดซา
APPO Western Pacific Regional Office to come on stage for the next presentation.
Hello everyone, so welcome, and to all the participants here and online, welcome to the 4th Asia Pacific Patients Congress. So I'm Paul Mendoza, President of Psoriasis Philippines and Psoriasis Asia Pacific, the regional arm of the International Federation of Psoriasis Associations. So I'm just here to give you what's happening here in the Western Pacific region when it comes to our healthcare system. We all know that for the past 2 years during the pandemic, most of the plans were halted, and we have a lot of challenges. But after I attended the regional conference for the Western Pacific for the WHO, for the World Health Organization, I'm happy to say that all of the member states are giving their full support in implementing the universal health care, the framework for mental health, for rare diseases, and for the NCD prevention and control. And I just want to encourage everyone who is here and watching that we are in this era where patients' voices and patient lived experience are very important and relevant in crafting these different health advocacies and health policies. And even in the World Health Organization, the patients' voices are very apparent, and they are still looking for meaningful discussions so that we could be able to implement what is best for the patients and to see what are the gaps that are needed to be filled. And we hope that in these 2 days that you will be able to learn the different frameworks, the different areas where you could be able to engage with your government. And as patient organizations, as patient leaders and advocates, this is the time where we should get involved in all the discussions, from the crafting of the policies, from the implementation, and even for the monitoring of these policies. So for the next 2 days, I hope that you will learn the different strategies, different frameworks that you could use in your own advocacy, especially in your own country. So thank you everyone, and have a good day.
ขอบคุณครับ Thank you คุณ Paul For the next presentation, we'd like to ask Kun Ellos Lodzeni, Vice Chair, IAPO, to come on stage. Please welcome Kun Ellos Lodzeni.
The chairperson of Heart to Heart Foundation, colleague board members from IAPO, our host Orajitt and Paul Mendoza from Philippines, the chief executive of IAPO, Kawaldip, distinguished participants, including those following online, members of the media, ladies and gentlemen, good morning, good afternoon, good evening, depending on the continent where you are. I feel greatly honored to stand before you on this auspicious occasion where IAPO, in collaboration with its member organization in Thailand, Heart to Heart organization, is hosting this important Congress. This is a memorable day in the history of IAPO, since we are now back to physical meetings since the advent of COVID-19. First and foremost, allow me to welcome all of you delegates to this Congress, and also let me thank our guests for according us the warm hospitality since our arrival in the beautiful town of Bangkok. We thank you very much for this. As you are aware, IAPO is a patient-led organization which exists to advocate for cross diseases internationally. We have over 300 members from all the WHO regions. IAPO is a pioneer non-racial cross-disease international organization of repute, which is in official relations with WHO. I am from Malawi, the African region, and I happen to be the vice board chairperson of IAPO. It's a demonstration of how non-racial IAPO is. Distinguished delegates, this meeting is one of a series of meetings which IAPO organizes in all the WHO regions. This is the fourth in this region, and we just had one for the Latin American region. These meetings are very important as they give a chance for patient organizations and its members to take stock of their activities, monitor progress made in patient advocacy activities, exchange information on various emerging health issues requiring inclusive patient involvement, as well as share best practices in advocacy and engagement. I'm happy to note that today we've been able to gather for this noble objective. For all of us to benefit from this gathering and achieve value for money from this initiative, there is need for all of us to accord the deliberations the seriousness they deserve. In this regard, I wish to urge all of you to actively participate in the deliberation, as well as strive to reboot from the effects of the COVID pandemic. Your maximum contributions and ideas will galvanize and marshal the required drive towards maximum and comprehensive, innovative, inclusive patient engagement landscape in the Asia-Pacific region and the world at large. This Congress could not have been successful without the support of various key stakeholders. I would therefore wish to express my deep gratitude on behalf of IAPO to the government of Thailand through the guest of honor for accepting to host this event. Special recognition should go to our board member, Orajitt, and your organization, Heart to Heart Foundation, for agreeing to co-host this Congress, and all the efforts you have made to have this well-organized Congress realized. I salute you and your team who were behind the scenes to make this event a reality. I would also like to thank our CEO, Kawaldip, and the team for the excellent work. To you participants, I'm deeply grateful for responding to our invitation. Without your presence, we could not have a Congress. I wish to urge you to keep on collaborating and participating in various IAPO engagements in the region and beyond. Continue to take IAPO as your only trusted partner international patient organization that is readily available to hold hands and share best practices. I also wish to thank most sincerely all our usual funding partners who are with us whenever we have events: Roche, Viatris, Prema, MSD, Borinja, and all those that I've failed to mention, for providing the necessary financial resources for this Congress to take place. I applaud you for championing the patient cause. Lastly but not least, my deep gratitude goes to the TK Palace Hotel Management for their warm hospitality according to us since we arrived. With these remarks, I wish you all fruitful and constructive deliberations. I thank you for your attention. Thank you.
ขอบคุณค่ะคุณ Ellos. Thank you very much, Mr. Ellos. And now we'd like to ask คุณ Kawaldip Sehmi, CEO International Alliance of Patients Organizations, to come on stage for the next presentation.
Thank you very much, Masters of Ceremony. Thank you for this and dedicated time. I must thank the dancers, the angels from heaven that descended to keep this stage clean. And I'm representing the patients this morning here. And that's the color. As a colorectal cancer patient, speaking on behalf of you all, as you know that we came through a great pandemic, once in a lifetime pandemic, hopefully, and that we learn from it. One of the questions that we were asked this morning was, why did you use that green shell in the middle? It's a nautilus shell. That nautilus shell represents systems resilience in human beings. And that's it. So we came through this system with resilience. Now I must thank everybody for having risked the Bangkok traffic to get there in time. There are more people. I've got 200 messages on WhatsApp. I don't know where they are, but I hope they're all here. Okay, on behalf of my board and on behalf of all the patients that I represent, I must thank Heart to Heart Foundation, our host, for welcoming us here. I must thank the TK Palace team for having made these arrangements. I must thank our friends again for the technical expertise that has been given to us, Manish and his team for being here and helping us out. And I must thank for everybody, all the speakers who will be coming with fascinating stories and fascinating insight, who bothered to join us late at night, early in the morning, and all the briefing sessions. So there was a cast of thousands that brought this event possible. So without much ado, I would just say that this program is quite an extensive program. We are looking at innovation and patient engagement. You can almost take this as building back better. How are we going to go forward? We must keep an eye on the rearview mirror, where we are coming from, but we also must look now at forward. How can we shape that healthcare within which we are part and parcel of that decision making and support? How can we build it better? As you know, many of you during the whole pandemic were sharing a lot of things on the Zoom meetings. And I must thank the Zoom company and manager that they brought the world together for the first time. We began to learn about each other's realities. The numerous home decor, we could see the cats and the dogs that interrupted us, and the children who stepped in. And for Thailand and Philippines, I love the quail bird, which is a bird that comes in spring, it speaks. It's a very beautiful word. And all the bird life we could hear. So without much ado, I would just say that thank you all. Let's prepare for the program and make sure that we have a great day. From patient safety and fire safety, please remember, please follow the signs for the fire exits. We have no drill today. If there's an alarm, it does mean that. For your comfort and access, as you know, as you came in, most of the washrooms are on the left. And if you require anything else, I've got lots of team members from Heart to Heart Foundation, as you see in blue. They'll help you out. Anything, if there's any medical assistance you need or anything else, please let us know. We're all patients. We know how to deal with this. And thank you all for being here. Let's make it a great day. Thank you.